I'm Dr. Ramon Ylanan. I've been here in Arkansas almost 5 years now, enjoying it quite a bit. My family and I moved up here early 2012. I actually was born in the Philippines. I grew up in Southeast Asia. My dad's Filipino, my mom's British, and lived in Southeast Asia till I was 16. Played lots of sports growing up, baseball, soccer, golf, dabbled in swimming, not so good at it, but everything else I enjoy doing. So sports has always been a big part of my life. My dad played baseball and soccer growing up. My great-grandfather actually was on the Olympics for the Philippines back in Melbourne. So there's a pretty good, strong family history of sports. So I've always been particular to sports. So when I got into medicine, I knew that sports and sports medicine were going to be the way I wanted to go and the practice I wanted to go down. I initially started my training at Ross University down in the Caribbean. Did my family medicine residency at Mizzou. And while I was there, that's really where I got with one of my first mentors, Dr. James Kindernecht, who was a team doctor for Mizzou. And he really kind of pushed me towards primary care sports medicine versus the orthopedic side of stuff. And really just kind of gave me that push to realize that I can do the medicine and I can do the sports at the same time. So I did my fellowship in Birmingham at the Andrews Sports Medicine Clinic with Dr. Andrews, Dr. Kane, Dr. Dugas, and Dr. Tracy Ray. And they kind of got me on the road taking that next step towards being a primary care sports medicine physician. When I finished fellowship, my first job was with South Carolina. I took care of the Gamecocks for almost 4 years. Primarily baseball, women's basketball, helped out with football. And after about 3.5 years there, the opportunity came up to transition over here. So left the SEC East and came to the West to be more of the head team physician for Arkansas from a primary care sports medicine standpoint. So that's what brought me to Arkansas, and I've always been with sports. My son's 8. He's into everything, soccer, baseball, flag football. My daughter's 4. She's in dance. She's into gymnastics, so we're a very active family. And that's a philosophy I've wanted to always pass on to my family is active lifestyle. And there's a lot of people throughout the world, throughout Northwest Arkansas, that an active lifestyle is important. And I've always looked at my job is to help maintain that active lifestyle for somebody, and whether it's an orthopedic issue, operative or non-operative, whether it's a medical issue that's hampering them from participating in the lifestyle that they enjoy, then I'm going to do my best to get them back on track doing all the things they love to do.